I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Zishan. May I know what brings you here today? Okay. Anything else? I'm very sorry to hear about it, Mr. Zishan, and I understand your worries, okay? But before I come to the conclusion or management part, I'll ask you a few questions. Is it okay with you? Thanks for your cooperation, Mr. Zishan. So since how long you are suffering from these symptoms? Okay, and how did it start? Gradually or suddenly? If anything happened 1 year back? Okay, and how frequently do you get these symptoms? Okay, is there anything that increases the problem? Okay, anything that relieves the problem? Okay, Mr. Zishan, what pushes you to perform repeated ritual? Is it some thought, images, impulse, belief? Okay, thoughts. Okay, Mr. Zishan, so what type of repeated ritual do you perform? Okay, and what do you do when you get these thoughts? Okay, and do you try to keep them out of your mind? Okay, and what happens when you try to keep them out? Okay, Mr. Zishan, are you a sort of person who is excessively worried about order lines or symmetry? Okay, and does your daily activities take longer time to finish? Okay, Mr. Zishan, is there any other mental or medical problem besides this in the past? Have you noticed any tremors while talking? Okay, Mr. Zishan, I'll ask you a few personal questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mr. Zishan. Mr. Zishan, do you smoke? How much cigarettes per day? Have you ever tried to quit this habit? Okay, I really appreciate Mr. Zishan, and we'll talk in detail in next appointment, okay? So, Mr. Zishan, do you drink alcohol? Okay, and how do you rate your weight if you are losing? Okay, and do you like to do exercise? Okay, and what do you do for a living, Mr. Zishan? Okay, so how are things at your workplace? I understand your worries, Mr. Zishan. And so, Mr. Zishan, do you have family, children? Okay, so how are things at home? And how about your sleep pattern? Okay, and how about your appetite, Mr. Zishan? If you had any head injury? Okay, and do you have high blood pressure, high blood sugar? If you take any medication prescribed by a doctor or over the counter? Okay, Mr. Zishan, is there any similar problem in your immediate family member? Okay, so Mr. Zishan, how this illness is affecting your life? What do you think? I understand your worries, Mr. Zishan, and I'll try to the best of my abilities to solve your problem. Okay, you need not to be worried, Mr. Zishan. I'm here to support. Okay. Okay, so Mr. Zishan, what I have gathered from the information you have shared with me, okay, it seems most likely that you're having a condition what we call in our medical terminology as the Obsessive Compulsive disorder. Okay, do you know anything about OCD? Okay, so do you want me to explain what it is? Okay, Mr. Zishan, you need not to be worried. I'm here to explain it to you, okay? Actually, this is not Actually, and this is not a serious condition, okay, Mr. Zishan. Let me reassure you first, okay. And the cause is not unknown, okay. And young person with a strong family history are mostly affected, okay. Actually, obsession is an unwanted and unpleasant thought, image, or urge that repeatedly enters your mind, causing feeling of anxiety, disgust, or unease, okay. And compulsion is a repetitive behavior or mental act that you feel you need to do to temporarily relieve the unpleasant feeling brought on by the obsessive thought, okay. So there's a reason it is called obsessive compulsive disorder, okay. So in this condition, a person performs uncontrollably irrational acts due to some thoughts and belief or image or impulse in his brain, okay. But let me reassure you, Mr. Zishan, that it is treatable, okay. I'll offer you some lifestyle changes and medication as well, okay. So is everything clear till now? Should I repeat it again for you? Okay, so Mr. Zishan, so let's talk about the lifestyle changes first. So I'll offer you some lifestyle changes like stress management, okay. And I'll encourage you to be relaxed, okay. Try to relax and try to sort out the cause of your stress, okay. And I'll encourage you to eat properly and eat healthy diet, okay. And do early morning walk, okay. And do some relaxation exercises like yoga and meditation, okay. And anything that makes you happy, have good sleep, okay. And I'll encourage you to keep a daily diary of your important work and perform your work according to your daily diary, okay, Mr. Zishan, if it makes sense to you. Okay, so besides that, Mr. Zishan, I'm offering you tablet fluoxetine, okay. You have to take it once a day at night time, okay. And it's fluoxetine 20 mg, okay. And besides that, I'm offering you to refer to psychologist for self-help, okay. And talking therapy like cognitive behavior therapy, okay. And it will include exposure response prevention, okay. Yes, Mr. Zishan, actually CBT will really have an effect quite quickly, okay, as the tablet I have offered can take up to 12 weeks before you notice the effects of treatment, okay. But most people will eventually benefit from it, okay. And I'm also offering it to refer to individual or group CBT and involving family and friends for exposure response prevention if required, okay. And besides that, I'm also offering you some addresses of self-help group organizations, okay, Mr. Zishan. Is everything clear till now? Should I summarize again for you? Okay, Mr. Zishan, I offer a follow-up visit after 1 month, okay. And we will reassess the condition, and if necessary, I'll refer you for specialist care to psychiatry department as well, okay. Okay, Mr. Zishan. So, Mr. Zishan, let me go through what we have discussed before you come to me worried about, okay. So first we talk about your sign and symptoms, okay, and then your personal history, and then your family history, okay. And then we talked about lifestyle changes, okay, and then about medication, okay, and CBT, okay, and then self-help group organizations, okay, and then about follow-up, okay. Is everything clear till now? Is there anything else you would like to share with me today, Mr. Zishan? Okay, Mr. Zishan, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you, okay? Take good care of yourself. I wish you healthy life. Okay, bye-bye.